I'm Dr. Jeff Rocker. I'm the medical director here at Skinology, and we're going to do some facial filler. We're going to use a product called Evolence, which is relatively new. It's a collagen product. Collagen was one of the first fillers on the market years ago, a product called Cosmoplast. Worked great. Doctors love using it. Didn't last very long. This is a new product engineered to last a lot longer. It's indicated for up to 6 months, but it may last longer. We're just going to refresh a little bit. And what I'm going to do here is we're going to lay a little bit of product right down here along the cheekbone just to make that a little bit fuller and bring things up a little bit. Just a little bit each side. And then we're going to put some in the nasolabial folds here. You know, as we age a little bit, the fat pads in our cheeks start to fall down. Gravity kind of pulls them down, and that's what causes these lines to form. And you know, she's got the smile lines around here.
Yeah, smile lines, because I'm always so happy.
You know, so we're going to put a little bit of product in here. She's got really nice cheeks already, so we don't really need to do much. We're really doing this more just to pull this part up a little bit. So that's what we're going to do.
How long does this last?
This lasts up to 6 months. Well, last 6 months, can last longer than that.
It can last up to a year.
Oh, wow.
But,
is that dependent on how much you use or what?
well, a lot of people's metabolism is different. So it's how you metabolize it, and then it's if you talk a lot.
All right.
Talk a lot.
Oh, Lord. Hers is going to be gone next week.
That's great cheeks.
Yeah, she doesn't need a whole lot in here.
Beautiful cheekbones. Tracy, if we're going to have this done, we have to have all these people coming. We will.
You know what? This makes it easier. It's like your little cheering squad.
The great thing about this product, about Evolence, is you have very little bruising and virtually no swelling.
Oh.
So you can get like a true feel for what it's going to look like.
It's going to look like what it's going to look like when I'm done.
Great.
Does that put it into place, or is that...
The Evolence, it becomes kind of permanent where it's going to be fairly quickly. So I can mold it now and kind of put it where I want to. That looks great.
Can you tell?
That looks great.
You'll notice. Unbelievable. I know.
Oh my gosh.
See? What we kind of do is we want to give you that triangle.
It's sad that you're so happy that it changes, but...
See, as we age, things start to fall. And,
Yeah, we know.
you know,
Again.
they call it the triangle of beauty, where, you know, the high cheekbones and then it comes down this way. Well, that's kind of what we're trying to restore a little bit, is give her more up here, and that pulls everything up and it kind of restores the triangle again. And, you know, you can see, I mean, those deep crevices that she had in her nasolabial folds, they're gone.
It's very, very natural, too. You're going to be so...
But she could walk out of here right now and people wouldn't think that she's had anything done.
Right.
Sadly, I'm going to go home and my family's going to go, where were you?
Yeah.
You got your hair done?
Yeah.
Which actually, though, that's a good thing, because I wouldn't want them to think, oh my gosh, what'd you do to your face? They're going to think, oh, you got your hair, you know, you just look, yeah.
And, okay, the second thing that we did is we did treatment with Evolence. Treated the nasolabial folds, which is right in here, and we also treated down here in the smile lines as well. How do you feel about the results from that?
That too, it was so subtle, but made such a big difference that I couldn't believe it. I couldn't believe, even that night when you did it, I looked in the mirror, I was like, oh my gosh, that's gone and again, it's not hard, it's not...
Feels natural.
I think there's a big misconception with a lot of this.
Right, and a lot of times there's different fillers on the market, and we can use a number of different products in there. Evolence is a collagen type filler, and collagen is a natural building block in the body. Works very, very well. But there's other products also that can be used too. But in your case, I think Evolence was the right choice in it.
Well, how would you know what to use? Is that dependent on the person?
It's individual preference, and it's also skill of the injector, his comfort level with different products. Probably the safest product to use is the hyaluronic acid products, or Restylane or Juvederm. They work well here as well. With the collagen that we use, it sets a little bit faster, so you have to be a little bit more precise about your placement and massaging the product to make sure, after we're done, to make sure that it's exactly where it needs to be. What's good about Evolence is no swelling or bruising.
Right.
There can be some bruising from the injection site, but the product itself doesn't cause that. Whereas Restylane and Juvederm, the hyaluronic acid products, they cause some more swelling. Some swelling comes because it brings moisture into the tissue, so you get a little more of that. Again, there's not a wrong decision in terms of which product to use. It's you just want to make sure you're using something that's FDA approved, and that you have confidence in the injector and his skills.
Well, I think that's a big thing too. And I've heard, like I said that night, I've heard so much since then of horror stories of people, and maybe they're afraid to ask what the skill level is. Or
we see people even movie stars and stuff on the news, and they look fake, and they look, and they probably it's because they've overdone it. They go in and get it done, and I just thought she looked so natural. You just took 5 years off of her.
You can always add. We can always do extra, but you can't pull it back out. Actually, with the hyaluronic acid products, Juvederm and Restylane, there is something. Say you had something done and you just absolutely hated it. We can inject an enzyme called hyaluronidase in there, and it actually dissolves the hyaluronic acid and makes it go away. So it is
fixable.
And that's why I say if you're really, really unsure, then use Juvederm or Restylane in pretty much any area to start with.